Bye-bye.
Our next presentation is from one of our own, one of our esteemed members of the executive committee, I believe a former chair of South County EDC, who has been doing double duty this year and playing a huge role in the community outreach for Scripps Hospital and their response to the COVID situation. So we have a presentation today by Monica Montoya, the Director of Community Relations for Scripps Health. Thank you, Monica.
Thank you, John. So I'm just going to share my screen here. Efrain, if you could give me, so I can share my screen, that would be great. So last public policy meeting, I just did a quick recap of just the picture in San Diego County, Imperial County, and a little bit of Baja. And Jim asked if I could come and do a similar type of recap for the entire board. So I have a small presentation. Let me pull it up here. Can everyone see that?
We got it.
Right, you got it? Okay, let me just, there we go. So this is just a very high level general update. And I know that Andrew from Supervisor Vargas's office will be filling us in a little bit more on the county. So I'll just run through these very quickly here. But okay, so for San Diego County, we are seeing the curve go the right way. We are seeing COVID hospitalizations decreasing, as well as COVID ICU cases decreasing. We are, however, still in the purple tier. And right here, you can see the trigger. So really, it's the adjusted case rate, which is still at 15. And this was as of yesterday's report. That number needs to be 7 or below for us to be able to move to the purple tier. And again, I'll let Andrew go into more detail on that. Just a quick overview on vaccinations. 21% of San Diego County has received at least the first dose of vaccinations, and 10% now has received both doses. They did open phase 1B of vaccinations on Saturday. So you are seeing a lot more categories that are now able to be vaccinated. And, you know, big applause to Supervisor Vargas's office for all her work she's been doing to make sure that the vaccinations are reaching our South County constituents who are in those categories, including the Promotora program, which has now been launched to reach out to our community and the walk-in centers that are only tailored to our zip codes. So that's really great to see. So thank you for that. Just really quickly, Imperial County, just to give you a little bit of perspective, for San Diego, the testing positivity is now at 4.1, which is a great drop that we have seen. Imperial County is still at 13.44 positivity. So even though they have also seen a reduction in their hospitalizations, their positivity rate is still coming back pretty high, so that's something to keep an eye on. They also have moved into their phase 1B tier for vaccinating, but as they indicated, and this is from their public health website, they're vaccinating 1B, but supplies allow. So they're keeping a close eye. And that's been the challenge with everyone with vaccination is the availability of the vaccines themselves. Again, San Diego County has really worked hard to organize and be poised to be able to give many vaccinations, many more than we are actually giving right now. We have been building the infrastructure. All our healthcare systems together with the county have been working to build an infrastructure that allows us to do many, many vaccinations. So as soon as we start seeing more vaccinations become available to our county, those vaccinations can go into arms fairly quickly. This is a quick recap of Baja California, the entire state. They report one day behind. So this morning they'll be reporting yesterday's numbers. So these are from February 28th. So you can just see these are the cities that are most impact San Diego County. So they're the ones that I've been pulling. They did announce that they will probably move to green line on March 15th. So that would mean that they would reopen pretty much all of their activities. And this does coincide with the Easter weekend. So it'll be interesting to keep an eye on after spring break if their numbers go ahead and fluctuate back up. We do have a quote there from the state secretary, that he's saying that they can open, but it's not set in stone, and they can, close back up as easy as they're opening. So they're really trying to keep an eye on their numbers, but anytime you do more reopenings, of course, you see infections go up, and reopening on a holiday week is going to be very interesting because we know that a lot of people do go down to Baja California for spring break. Even though they do plan on their reopening, the same article included to say that does not mean that the border is going to be reopening, because as we know well here in South County EDC, that's an international agreement between Mexico and the United States. So what San Diego County does and what Baja California does is very independent as to what the federal government decides to do at the border. And this is something I shared at Public Policy. This was a report that came out from the Baja California State Secretary's office. They did this study, it was about 2 weeks ago, and they identified that more than 16% of those people who have been infected with COVID in Baja California have actually lost their lives. So this isn't just the hospitalized, these are everybody who's experienced COVID. And when we looked at Tijuana, it actually stood out. They had more than 20% of their confirmed COVID cases had actually passed away. So that meant 2 out of every 10 positives had lost their lives. So that's a pretty striking figure. Mexicali is the municipality that has the highest number of infections. And as of the February 28th report, the COVID deaths in Baja California were averaging at more than 20 deaths per day. So the numbers are dropping, but the death rates have really increased. And so that's pretty concerning there as well. And that is my quick recap for today. And Andrew, if you'd like to share more on the county, we'd love to have you give us a few words.
Well, thank you, Monica. Yes, we'll go to Andrew and then we'll open it up for questions for both of you.
Awesome. Thank you so much, Monica. Good morning. Buenos dias a todos. I'm Andrew Harvey. I'm the community rep under Supervisor Nora Vargas for District 1. So I'll start off with some COVID mitigation at the county level. So top priority for Vice Chair Vargas continues to be the fight for health equity for our South County communities that have been disproportionately impacted during this pandemic. As co-chair of the COVID subcommittee, Vice Chair Vargas has ensured vaccination infrastructure is in place in South County. This region now has 7 community vaccine pods, including 1 super station in Chula Vista. Recommended intervention programs after hearing about challenges, barriers people were facing with technology due to digital divide and language, from Project Save, which is scheduling appointments for vaccine equity, which redirected current county community partners with Promotora programs to assist with scheduling appointments at 4 pilot sites in Chula Vista, San Isidro, Imperial Beach, and National City. Expansion of the capacity of 211 to assist people over 65 with setting appointments. Implemented pilot programs at 2 South Bay sites this weekend to gauge how walk-up system can work. As of yesterday, March 1st, the Borderview Family YMCA in Otay Mesa will have 200 spots available for walk-ups for first vaccine doses, which is awesome. This past week, Vice Chair was proud to be able to deliver for our South County schools. While the county had already set aside 20% of vaccine supply for teachers, Vice Chair Vargas worked with Dr. Wooten and county staff to ensure school districts in South County were not left behind. And I can confirm that schools, especially those in the 92154 and 92173 zip codes that have remained closed just due to high COVID case rates in the region, will be able to have their teachers vaccinated. And last week, Vice Chair Vargas, jointly with Assemblywoman Lorena Gonzalez, launched the South Bay Equity and Economic Recovery Task Force. So this task force is comprised of committed, solutions-driven leaders from different segments of the community, from business, community, organized labor, educators, and our binational partners. This is going to be a real working group that is going to be addressing what a continued COVID-19 mitigation and equitable economic recovery looks like. And switching subjects real quick to the Tijuana River Valley. So last month, as part of her environmental justice policy package, Vice Chair Vargas brought forth a resolution declaring the cross-border pollution of the Tijuana River Valley a public health crisis. It was unanimously approved by the Board of Supervisors. With this declaration, Vice Chair Vargas will continue to advocate for more state and federal funding, not only to address the infrastructure needs, but the public health needs from residents being impacted from decades-long pollution. She has been in direct communication with officials from the state of Baja California to discuss the priorities for our region and the need to focus on building infrastructure on both sides of the border. Vice Chair Vargas also emphasized the need for a strong commitment from local, state, and federal governments on both sides of the border to mitigate this international crisis, and has already reached out to the Biden administration to lift this issue and help bring more resources to the region. And open to answer questions. I'm also going to put my information in the chat, so if you would like to reach out to our office or myself, you're more than welcome to. Thank you.
Thank you, Andrew. Do we have any questions for Monica or Andrew regarding our current COVID situation? Monica, what are we hearing about the supply of the 2-dose vaccines? Is it still just day by day that literally people at Scripps and the other places are finding out when they're going to get it and how much?
Actually, that I would probably defer that question to Andrew. The county receives the allotment and then they distribute it to the hospitals. I know that there have been, due to weather, there were some setbacks as well. That was, I believe, last week. But Andrew, any more to add on that?
Things change so rapidly at the moment since the closure of Petco. There's been really congestion with a lot of people booking their second appointments. Things can change overnight, so we're still waiting on the supply side. But as soon as we have information that we're going to receive more shipments, we'll communicate to all the community partners just so they can stay informed about appointments and what's going on.
Monica, I know during our discussion you had shared that, all of the folks at Scripps are actually doing double duty and actually putting shots in arms, or as the British are saying, jabs. For those who have been vaccinated, how can they get involved and help? Because obviously there's a shortage of people that can actually get needles in arms.
Yes, most definitely. Well, Scripps has opened one super station. We know Sharp has the one here locally in Chula Vista. UCSD has the one in downtown San Diego. So a lot of these super stations do take a lot of manpower. And so for us on the Scripps side, we've pulled a lot of volunteers from our system to come and help with the super stations, just staffing them while we're getting all the cars coming by. But definitely, I think that one of the expertise that is most needed are those people who can actually administer the actual vaccines. So if there's anybody who can, I know the county had a sign up for for volunteers. And if you're interested in signing up to volunteer at our superstation, please just send me a note. We're happy to have you. But yeah, it's really taking a lot of teamwork to get all of these state superstations and pods going, and making them organized so that we expedite people in and out and do it in a safe manner, because we do still have to follow all the precautions and the social distancing and everything like that. So it's a big orchestration.